go through some material that is on the CPT intranet site, and then for those individuals that are on the call, they can go to the site and see the material that I'm referring to. Want to say thank you for everyone attending the call and apologize for some of the technical difficulties. This is our monthly call where we talk about certain aspects of the health insurance program that are available. This particular conversation is really for all CPT employees that may be covered under a health plan, not necessarily the CPT health plan. What we want to talk to you today is about August, and that's prevention month. And as we take a look at our own healthcare cost, our own wellness, want to send out reminders to the audience about certain ways to make sure that you're complying with your own internal wellness guidelines and understanding how you can impact your healthcare consumption. These days you may feel overwhelmed with all the health information available to you. There are really only a few basic tips to keep in mind for your optimal health. We want to make sure that you can eat healthy. We want to make sure that you are moving. Very important to watch your weight. And then very important to get enough calcium and manage your stress levels. For women, want to make sure you can get enough folic acid. Want to make sure you get tested for breast cancer, and want to make sure you get tested for cervical cancer. For men out there, we want to, if you're age 50 and older, want to make sure you pay attention to your prostate. These are all wellness guidelines that you have 100% coverage for in the health plan, subject to your age and the wellness test that your provider would offer. As it relates to what you can do now, regular physical activity is vital to good health, and especially important in maintaining and losing weight. Most Americans are well aware of this, yet many remain sedentary. According to the Centers for Disease Control and Prevention, an astounding 70% of adults are not achieving the basic recommendation of at least 30 minutes of moderate physical activity 5 days a week. Now, I myself try to maintain this and find it very hard to do within the workplace, so understand that we all have challenges. However, exercise should not be dismissed as if I have the time option. It needs to be a part of everyone's lifestyle. So what the article on prevention, talks about is the benefits of physical activity. Exercise can help you control blood pressure, blood sugar, weight, help raise your good cholesterol, and prevent diseases such as colorectal cancer, heart disease, and type 2 diabetes from becoming active. It can also help you to look your best, raise your self-esteem, improve your sleep, strengthen your bones, reduce falls and arthritis pain, lower chances of becoming depressed, and exercise actually can be fun. As you take a look at the material that we've posted on the intranet site, there is a couple of suggestions as to how you can build exercise into your daily activity. The final piece on the prevention newsletter that we have is relating to helping you know your numbers. And I understand within community physical therapy, we have a number of clinicians. However, understanding your numbers is very important. Heart attack, stroke, kidney disease, diabetes, and many other chronic conditions have potential to be prevented by simply being familiar with your body and taking actions to stay healthy. You can do this by visiting your doctor annually, as well as getting your cholesterol, blood pressure, and blood sugar tested regularly. Learn about what actions you can take to ensure you live a healthy life. Cholesterol level, so under the Know Your Numbers, the prevention newsletter has the numbers that you should look to maintain. Total cholesterol should be 200 or less. Blood pressure should be less than 120 over 80. Blood sugar should be below 100. And body mass index between 18.5 and 24.9. look at August and Wellness Month, would encourage everyone to tap into the hard copies of the material that I've just referenced for this call. That information is located on the CPT Intranet site. Thank you for attending the call. And at this point, again, I apologize for the technical difficulties, but if there's any question about the wellness that I've referenced, having 100% coverage in whatever health plan you have, I'll ask Tom to open up the line for questions.
Okay, John, thank you for that. I'm going to unmute everyone, so please keep the volume to a minimum in the background. If you have a question, please go ahead. Okay, John, I guess there are no questions for today. Thank you very much for your presentation.
Thanks, Tom. Bye.
Bye.